After recovering from COVID, you should look for these signs in your mouth. You may notice blackening of the tissues of the mouth, or you may have white coat on your tongue. Your teeth can suddenly become loose and you may have swelling in your mouth. You may experience numbness in your mouth or lips. You can also develop multiple ulcers in your mouth and you can also experience loss of taste. You should also look for these symptoms like runny nose, bloody or blackish discharge from your nose, nasal congestion or pain near the sinuses, one-sided swelling of the eye, black color formation on your skin or inside of your mouth. You can also have low-grade constant fever, blisters or redness. Let's have a look at the precautions you should take after you've recovered from COVID. Once a person recovers from COVID, the next 2 weeks are very important for him or her. First thing is to keep the underlying condition under control by proper medications, diet and exercise. Immunocompromised patients should wear a N95 mask almost all the time because these fungal spores are present in the air. You should be wearing long sleeves clothes or even gloves while gardening or touching the soil to prevent these spores from entering the body through skin, mainly through cut. Let's move on to what you should feel for. If you notice any abnormalities in your mouth or even any black lesions in your mouth or on your face, then you can use your thumb and fingers to check for the softness of the lesion. Suppose you notice any black patch in the roof of your mouth, then you can have a look and check on it like this. Say suppose this is your mouth, and when you open it like this, you can just use your thumb to go behind. This surface here will be a little bit rough, which is generally present in everybody's mouth. So you can just go a little behind and gently press on this area. It's called the palate, which is like a thin bony plate present in everybody's mouth. So when you press with your thumb like this, if you feel any softness and if there is a black lesion over here, then there is some abnormality. So what you're looking for is some softness or some crackling sound which you can hear or you can feel with your thumb. You should also feel the hardness of the bone on which your teeth are supported like this. Using 2 fingers, or actually using your finger and a thumb, you just open your mouth and just go inside the mouth and just do like this and feel for the bone. So this is the bone on which your teeth are supported. So you just have to press that bone with 2 fingers like this, going inside your mouth all the way here behind and both the sides behind, and feel for any abnormalities like softness or again a crackling sound. You should also look for any black lesions underneath your tongue, that is the floor of the mouth over here. In the same way, you should feel the bone which is underneath your teeth, that is the upper jaw, in the same way like you did for the lower jaw, like this. You should also look out for some black lesions in this area as well. Moving on to the face, you should start feeling your face beginning from the corners of your nose. Just move on like this. This is where the bony structure is. Beneath the nose. And so this is the area where the sinus is, where the fungus affects. So check for any softness involved over here in this area. Next, you can move on to the nose. So the tip of the nose is generally soft, but if you go a little bit upwards, it's the bridge of the nose which is hard and there's a bone over here. So check for any softness involved over here. And then you can move on to the forehead area like this, the eyebrow region, and just feel the bone surrounding the eyes and feel for any softness involved around this area. You should also try to feel your jaw bone. So this is how you feel it. So just starting from this area underneath the ears and just go on like this. With both the hands you can try. In the same way from this area. So feel the whole jawbone. If you notice any abnormal patches on your face or mouth, then you should visit your doctor as soon as possible. And if you are not able to do that immediately, then you should just give us a call on our helpline number. You can also take pictures of the relevant areas of your face and mouth and send it to us. Please download the Dental Dose app to keep a regular watch on your teeth and mouth and an instant diagnosis for free.